having a regimented approach to solving a problem is always going to give you a better probability of having a good outcome. So
Mm-hmm.
I can never, like for any of my clients, I can't guarantee success. I can't guarantee them they'll be back in X number of months. But what I can guarantee them is we're going to follow this kind of like step-by-step approach. And along the way, we're going to have these like kind of like milestones or checkpoints where we say like, all right, in order for you to do this next thing, you need to demonstrate to me that you have full range of motion. Okay, that looks good. You need to demonstrate that you have good strength and
Mm-hmm.
control. Okay, that looks good. Now we can start getting into some of the more fun, like performance training type stuff, like our power training, our jump training, our landing, then getting into a little bit more of like our elastic stuff. Like how can we kind of start to titrate a little bit more of like our pogo progressions, running progressions, like more dynamic plyometrics. Okay,
Mm-hmm.
that stuff looks good. How can we kind of push the needle forward?
Hello and welcome to this episode of the MTB Performance Project. I'm your host, Mickey Bruckner, and on today's show we have physical therapist Mike Reinhardt. Mike, good to have you, brother.
Thank you for having me, Mickey.
Yeah. I was excited about getting you on. You're somebody that for many years you were with us at the Annex, working with a lot of our athletes with resilient performance physical therapy, and before that you were kind of in more of like a larger scale model of physical therapy. So you have a very cool blend of knowledge being in like larger scale model, tighter scale model with one-on-one physical therapy and care. And also you're a physical therapist who likes to lift and somebody who walks the walk in that regard. So a lot of firsthand knowledge and experience, not somebody who's lecturing and talking from theory. You're talking from true practice. So I appreciate you.
Oh, absolutely. Yep. I love to walk the walk.
That's important. It's important. I wish more people would understand the importance of that. But yeah, so you've been in physical therapy for how many years now?
So I've been a performance physical therapist for about 7 years now. That doesn't include any of my S&C experience or my past, like my clinical experiences, which accumulated like another entire year. So like if we go way back when, like I got into basically like training as like a 15-year-old who just wanted to get bigger. Like I was
Yeah.
never like an exceptional athlete. Like I love sports, I love training, I love lifting, but
Yeah.
I kind of got into it as like a naive freshman in high school who's just like, I want to put on some muscle and I just want to kind of get good at this stuff. So I think I have a similar career trajectory to many strength coaches
Hmm.
where they started to see those initial gains for like the first year or two. I was getting bigger, I was getting stronger, like I was loving life, I felt really good. And then you start to get to that plateau of like, oh crap, I'm doing the same thing, but I'm not getting better. So then what do? Like you work harder. You do the same things, but you do more of it, or you push harder. So like I did that for a little while. And then by the time I was like a junior or senior in high school, I was really fortunate because I had some coaches and trainers that were at my local gym who kind of saw me like spinning and kind of doing the same thing. And they took me under their wing and they gave me a little bit of guidance. And ultimately, because of people like that, I actually got into exercise science as my undergrad at University of Buffalo. And I just fell deeper in love. Like I love anatomy, physiology, training, program design, like all of that stuff has always really appealed to me. And as I went through undergrad, I was like, I really love this, but how can I do this at a higher level? And potentially, like, how can I do this for a broader audience? And I was also fortunate to have a lot of really good friends who were either in physical therapy school or going to physical therapy school. And the more conversations I had with them, the more I followed people like Kelly Starrett with Mobility Watt at the time and Quinn Hennick in the earlier days. Like all of those people were like, I liked how they thought. I liked how they approached problems. And honestly, I liked that they walked the walk, right? Like they trained, they worked out at gyms, like they were just really, really good people. And I looked up to them. And that's kind of what got me into the realm of performance physical therapy. So, like, my career in a nutshell has been the first 4 or 5 years, I was at a place called Rehab to Perform in DMV area. And during that time, I just got a lot of reps. Like, I saw tons of athletes, tons of kind of like general population, fitness population. I had over a dozen students. I got to onboard other physical therapists. So I kind of just got to do a lot of different things. And it was cool because in retrospect, I worked my butt off, but I also diversified without realizing that I was diversifying. So I had business exposure, I had clinical exposure. I got involved in R2P Academy, which was a continuing education platform at the time. We did that for about 5 years of teaching courses across the country. And all of that led me to my time with you in Resilient, where I wanted to get better at being a clinician, being a coach. So having that one-on-one practice where you're with people for a long period of time, that really appealed to me. And ultimately, I feel like that sharpened my skill set to a T. And now I'm kind of in the next phase of my career, which I'm sure we'll talk about as we go forward.
Yeah, and that's like I said, most people, who are doing what you're doing now from like an online coaching and mentorship standpoint, very rarely in my experience are they people who have actually done the stuff that they're preaching, right? So, And that's something that you have a ton of experience and firsthand knowledge with, both, like you said, the clinical, then the performance rehab setting, athletes, general pop, like you've kind of dealt with it all and done it in with a pretty high volume and had a ton of experience. Kind of my next question is so for, 5-10 years ago, people saw physical therapists as, khaki pants, collared shirt, come in, that rub some ankles and put you on some ice and stim and you go on your merry way. And now the quote unquote performance physical therapists have started to come along with people like yourself, right? People who don't just have an extensive background in physical therapy, but have a lot of experience in the performance side. So tell us a little bit about how that has kind of evolved the profession of the physical therapist into quote unquote a performance physical therapist.
Yeah, I think a lot of it has just come out of the demand for it because for the longest time, like that's what physical therapy was known for. It's
Hmm.
like if you're an athlete and you have an injury, like you need modalities, right? Like you need massage, you need ice, you need compression, you need stim. And obviously, we both appreciate there is a time and a place for that. I'm not saying those things are bad, but like ultimately, what you just asked comes down to this idea of like the rehab to performance continuum, where if you're dealing with an acute injury or some sort of surgical, like post-operative protocol or something like that, you need to manage that appropriately. But there's a huge gap between like finishing what old school PT used to be versus like getting back on the field as an athlete. So I think ultimately like the whole idea of a performance physical therapist is someone who understands the intricacies of the early stage rehabilitation, but also have a really good appreciation for how do we progress somebody back to what they need to do for their actual sport. And like that's as much an art as it is a science because the reality is like you can't just do strength training. You can't just do plyometric or field based stuff. Like you have to know how to blend a lot of different fields into one practice. And I think that's kind of what has appealed to me all these years is like how can you be a good physical therapist? How can you be a good strength coach? How can you understand like the orthopedic side in terms of what they do with the actual surgery? And the more of these realms you kind of put together, the more of a complete picture you have of like what this athlete needs. Like I think I look at it as like a giant puzzle of like obviously there's some kind of injury, there's some kind of deficit, or even maybe it's even just performance based. But it's like, all right, what is this person currently capable of doing, and how can we kind of push the needle forward every single session to get where they need to be? So it's like I'm sure we're all familiar with this idea of like reverse engineering somebody's process. Ultimately, performance physical therapy is reverse engineering. If you look at their future goal, whether it's their athletic activities, their training activities, or just their daily activities, where are they right now comparative to that? And how can you take regimented steps to get to that point? Like we can look at something like if somebody just had like an ACL reconstruction, which we know is a large time loss injury, their first 2 or 3 months of rehab is going to be very basic. Like that is more of your run of the mill PT because it has to be. Like we want
Hmm.
them to walk normally, we want their knee to feel good, we want them to be out of pain, we want them to start getting stronger. But then it's like, all right, now they're walking normally, but how do we get them back to sprinting, cutting, jumping, change direction, contact? That's a very big gap. So it's like, as you know from your work at the Annex, it's like, how can we take somebody through like a 6 to 9 month process to make them really, really resilient and robust in terms of their ability to get back to those things? And like that's where it's like that's where the fun kind of comes in with me, where I look at this as like, all right, we have a lot of time with this person. How can we have a regimented approach to getting this end goal based on where we are now? And like that's the strength coach in me. Like I love that. It's like you can periodize it, you can program it. Obviously, day-to-day fluctuations are going to exist, but you're monitoring their progress over a long period of time. And my other favorite thing is like you get to make really tangible changes in this person's long-term outlook. Like you and I personally worked with some of the same athletes, which is kind of cool because I can think of some specific athletes you and I both worked with where I've seen them change from not only an athlete but also like their personality in terms of how they approach training. Like I've seen some kids that have fallen in love with training because they've seen the same dividends that I think you and I saw when we started training ourselves. So like that's a long-winded answer, but I look at us as like we're almost like a true performance physical therapist is a really good performance consultant. Like we're good at the early stage, we should be really good at the mid stage, but then we get to the later stage and we entrust other people to kind of finish that process for us. Like I'm not claiming to be the best strength coach, I'm not a sports coach, but I understand like how can I get an athlete to the point where they can work with them in a safe and efficacious manner.
Well, I love that because you kind of touched on a little bit of the physiological and physical and just overall like motor control standpoint, but then you also touched on the psychosocial and the mental aspect of it, right? Like getting people to fall back in love with this because they come back from a surgery like they just have this fragile mindset and they're so worried about re-injuring and all that stuff. And like I lived that from my experience from 2 elbow surgeries, I lived that for 2 years. And so getting back into training was something that helped me progress along and get into that next stage. So in that light, right? Like you're coming at it, the perspective of a physical therapist. So if I'm a physical therapist who doesn't necessarily work in that capacity and really just kind of looks at things from the clinical standpoint, what are some things that I can operationalize in order to make the back end of my physical therapy process better for that athlete to come back to play?
Yeah, for sure. Like I think there's a lot of merit. Like there are certain facilities that just don't have the space or the equipment or potentially the expertise to get to that like mid to later stage like rehab for higher level athletes. And that's totally fine. That's not a dig against those type of facilities. But I know a lot of physical therapists that work in those settings that are still exceptionally good at their job. And it comes back to what you just said of like, what is their process? Like how do they keep themselves accountable in terms of having a regimented approach to solving a problem is always going to give you a better probability of having a good outcome. So I can never, like for any of my clients, I can't guarantee success. I can't guarantee them they'll be back in X number of months. But what I can guarantee them is we're going to follow this kind of like step by step approach. And along the way, we're going to have these like kind of like milestones or checkpoints where we say, like, all right, in order for you to do this next thing, you need to demonstrate to me that you have full range of motion. Okay, that looks good. You need to demonstrate that you have good strength and control. Okay, that looks good. Now we can start getting into some of the more fun, like performance training type stuff, like our power training, our jump training, our landing, then getting into a little bit more of like our elastic stuff. Like how can we kind of start to titrate a little bit more of like our pogo progressions, running progressions, like more dynamic plyometrics. Okay, that stuff looks good. How can we kind of push the needle forward? So I think in the lens of the question you just asked, like mid stage, like quote unquote mid stage, is generally like the athlete is back to normal training. So, as any physical therapist, regardless of your setting, you should be pretty competent in terms of taking that person from the point where they're not able to do much of anything to the point where they're back to good training. And if they're doing that, they're confident. And to your point of like, kind of like restoring that almost like fractured ego, the better they get at that, the more competent and confident they're going to be when they get back with a performance coach, with a sports coach. So, I look at it as like, it's really, really easy to be passive in the early phase of rehab. But the reality is, if you give that athlete more autonomy and you give them an idea of like, hey, this is what we can do right now that's going to pay you dividends in the future, you get them to buy in, right? Like as having an athlete like an athletic mindset, we're always looking for how can we be better. If you play to that personality trait and you give them things to look forward to, that athlete is always going to buy into what you're doing and they're going to be putting more effort forth as
Yeah.
opposed to just sitting on their couch and saying, okay, when can I go back to sport? Like it's not a passive process. It should be active throughout.
Yeah. And from my experience, when I'm working with physical therapists like you guys and our team here, that's an easy transition for us to take to get the baton and get them to the finish line. Um, but as you said, there are systems and facilities that don't necessarily have those resources and the bandwidth to do that. Um, and it becomes tough, and maybe it's a confidence thing and physical therapists, much like strength coaches, like they kind of want to stay in their lane and that's not their lane, so to speak. So now speaking more specifically to like a strength coach who might not understand the earlier stages of return to play. So now from my perspective, what are some things that I as a strength coach can do better to maybe collaborate and communicate better with somebody like yourself who is taking somebody, let's just say an ACL for example, like back from, hey, they're ready to start training. What can I start to do with that athlete that can really piggyback on what you're doing, but also really capitalize and take advantage of the time that we have with that athlete?
Yeah, for sure. Like, and honestly, you do work in a pretty idealized setting. Like having worked there again for a number of years, it's like as a like if you have physical therapists in house, having a conversation is the easiest thing. Like if you
Yeah.
both know the athlete, if you're both working with them, just having a casual conversation of like, hey, in physical therapy, we're working on these things. Usually, what I look at it as like, all right, if we're on this continuum like rehab to performance, the early stages, the physical therapist is kind of like in charge in terms of like the more intense stuff, but the strength coach should be doing everything that has already been established. So in the context of like ACL, let's say theoretically they're like 4 or 5 months out, so they should be getting back to some kind of running. In most instances, they're doing their running type interventions with the physical therapist. But in order to get back to running, you need to restore at least baseline levels of range of motion, strength, and power. So once they've established that, or at least it's kind of like good enough, as a physical therapist, what I'll say to a strength coach is, hey, be like, hey, on these days, we're working on a little bit more like power based, elastic, decelerative type work. But during their sessions with you, I want you to work on like more of your max strength work. I
Yeah.
want to work on more of your conditioning work, more of like your tempo work, because there's always a time and a place for how can we push the ceiling of strength while we're also working on other desirable capabilities.
Yeah.
Because personally, like honestly, physical therapists in general, I love having strength coaches helping me because I just don't have enough time in the world to
Yeah.
see somebody
Yeah.
for 4 or 5 sessions a week. But if they're doing 2 sessions a week with a strength coach and 1 or 2 sessions a week with me, that is ideal because literally what we can do is we can have like a truly like dynamic and periodized program where potentially the physical therapist is introducing new skills. They're doing things that are like less safe to fail, quote unquote, while the strength coach is doing stuff that was maybe done a couple weeks beforehand and is already being done with good competence. So it's like I look at it as like, all right, let's take like the 4 or 5 month ACL. During that time, the physical therapist is like, all right, we're doing running progressions. We're getting into more linear acceleration, deceleration. We're doing a whole lot of like pogos and more like extensive plyo based stuff. But during that same time period, like, guess what? The strength growth coach is just crushing strength work. It's like if you can have it where theoretically, like they have the first part of the session with the PT and the second part with the strength coach, where they do like their kind of like their burnout type stuff or their more intense like strength work, that can work really, really well. In other instances, it's like, all right, work with a physical therapist on say like Monday, work with a strength coach on Tuesday, work with a physical therapist on Thursday, strength coach on Friday, just so there's some inherent recovery and it's not back-to-back sessions all the time. But like having that interplay where you're just discussing, and even from the standpoint of like as a physical therapist, I will never claim to be the best strength coach. If I have a strength coach who gives me feedback and says like, hey, this athlete keeps doing this or they don't look really good in these positions, I'm going to take that information and be like, all right, how can I help work on that? Because ultimately it's like two different perspectives trying to solve the same problem. Like we're both trying to help this athlete or this individual get back to what they need to do. Like I'm more than happy to put my ego on the back burner and say like, all right, this is what I'm really confident in. I
Hmm.
want your expertise from a performance standpoint to help me get this person to where they want to go.
I think that's great because it's the way I look at it is I'm always like the person. It's like, okay, what have you already done? What are we starting to build volume and intensity? Like, look, we need to look at load, we need to look at volume, and need to look at intensity, and how are we continually progressing that? And a lot of times, it's like you guys are introducing all those new things within the rehab process. Once they've established 2 to 3 weeks of that with you guys, and now it's like, okay, they can jump, they can sprint in a straight line. We're managing a lot of that stuff, but then you're starting to integrate, more reactionary type change of direction, more game speed, like type of things. That's done with your watchful eye, and to be honest, like the way you guys operate it, it's one-on-one. You can manage that thing, real time. Whereas like they're coming into us in a semi-private, like small group setting. So we're just kind of, essentially doing the things that maybe aren't as big of a priority, who have already like qualities that have already been established, and now we're just continually building upon them. And that's kind of the way I look at it. And look, that takes communication, right? That takes a lot of back and forth and understanding, what are the feedback that I'm giving you as a strength coach? Like you said, this athlete's still struggling with this, or they're getting pain on this. Well, that's valuable information for you, because if it's something you need to integrate back into your process, like it's there. So
Ultimately, it's like the more data points you have with the same athlete, the better decisions you can make. So it's like if you
yeah,
have two coaches who put their head together, generally speaking, your outcome is going to be better because you're just getting more perspectives and you're getting more information.
yeah. And one of the things that I also see it as a benefit to the athlete is like it's real happening real time, and so there's no lag. And you touched on it earlier, is like having a strength coach and a physical therapist in the same building. We communicate on a day-to-day basis, right? So if there's issues, like we address it right away, rather than, hey, I'm working with this physical therapist in another building. Hey, this athlete had this struggle. They get back to me 2 or 3 days later in an email, and then I like it's just there's just too much of a lag. So at the end of the day, it always trickles down to the athlete and becomes a better experience for them overall. So
For sure.
yeah. Um, so you've had a lot of experience in terms of like data collection and like sports science type stuff in the PT process. Can you tell us a little bit about, like, when it comes to data and the certain KPIs you're tracking on an objective standpoint, like what are some of those things that you're looking at, and how are you using it to inform the return to play process?
Yeah, for sure. I think like context wise, I think for me and just in general for listeners, like using an ACL is probably the easiest way to go about this because generally it's at least a 12-month process. It should be fairly linear in terms of if all goes well, it's like, all right, we're making gradual progress the entire time. And it gives us some like consistency in terms of like when are we actually checking data, when are we doing testing, and when are we kind of like doing some of that like sports analytics type side of things. So like you mentioned, like KPIs can take many, many forms. I literally go back and forth on this, and I've discussed this with a lot of the resilient guys as well, of this idea of like I really like this idea of like training is the test. I think that in many circumstances that is a very, very good outlook. The only downfall and the caveat to that is if you're only doing training and you're not doing any sort of like formalized testing or data collection, you might be missing more of like the nuance, or like really good athletes are good at compensating and hiding things. So it's like I look at it as I totally agree, like training is the test. It's the primary test because you're doing it every single session. But ultimately you need to keep yourself accountable and make sure that you're kind of like minimizing your biases and giving yourself opportunities to make sure you're actually doing as well as you think you are by doing some kind of like periodic or serial type testing. So like if we use the context of ACL, it's like the earliest KPIs that we care about are things like swelling management as well as like joint range of motion. So is the circumferential measurement at the joint similar from side to side? Like as they get further from the injury, it should be more and more symmetrical from like a joint standpoint. Obviously, there's going to be loss of muscle mass, so like their limb girth measurements are going to be different. But that's also something you can manage and kind of monitor over the course of like 9 to 12 months because you should see pretty big changes there. Once they get back to the point where they're actually doing some kind of training, I try to keep it as simple as possible from like a data collection standpoint there, where I do a lot of like isometric based, like knee extension, knee flexion based testing, because you can get some sort of objective data point of like what is their peak torque at their knee. So if you use like a knee extension machine, if you use a Tindeck, you can get really easily quantifiable numbers. One from a formal testing standpoint of like, hey, how many kilograms of force can you produce at this knee angle in these positions? But you can also use stuff like, all right, if every single session we use a knee extension, how many sets and reps are we doing with that particular weight throughout a full range of motion? If we're seeing improvements across like multiple sessions, it's like, all right, you're doing 3 sets of 10. Last week, you literally started at 40 pounds on your affected leg. A couple weeks later, you're doing 60. It's like, yes, like we may not be making structural changes quite yet, but from a force output standpoint, we're seeing like tangible improvements. So we know it's going in the right direction. So I think easy, like early on, start as isolated as possible. Then as you're getting to like the middle stages where the athlete's doing more and more, so they're running, they're sprinting, they're stopping, they're doing some kind of change direction. Now we need to be a little bit more potentially creative in what kind of metrics we use. So as you and I both know, it's like I really do like force plate technology because if you have access to it, you have an instantaneous look at how they're actually interacting with the ground and comparing one leg to the other leg. So it's like early on, it needs to be isolated from the standpoint of don't let the athlete cheat the test. So if we have an affected muscle, affected joint, or affected extremity, we want to isolate that as much as possible so we can compare it to the other side and see some sort of like relative symmetry. As they're getting later on, we want to look at more of like their more of their like systemic outputs. So how are they doing things that are more dynamic? How are they landing? How are they jumping? How are they doing counter movement jumps? How are they doing depth jumps? How are they doing repeat jumps? So it's kind of like this, we have an unlimited number of tests that we can use. The better question that I always pose to colleagues and strength coaches is what are the tests that are going to give us the piece of information we need right now? So it's like
Mm-hmm.
based on this athlete, they've already demonstrated really good force output. That's awesome. Like that's a huge box. Okay, but they still don't look great when they're accelerating or decelerating. What's the missing step? Okay, let's look at things like rate of force development, or let's look at their strategy when they're landing. Are they using a very stiff strategy where they don't feel comfortable getting into more of like a lower base of support position, or like kind of dropping their center of mass, whether it's a lunge, a squat, whatever it may be? If that's the case, it could be a coordinative deficit, or they just don't move really well under velocity. So if that's the case, like let's use some kind of accommodating resistance with their strength programming. Let's
Mm-hmm.
get them more comfortable with eccentric velocity, right? So that they can get into those positions quickly. Okay, now that's starting to clear up. Cool, they can decelerate a lot better, but guess what? Their first couple steps still look like garbage. So is this a coordinative deficit? Like, do they not feel comfortable rapidly extending their knee? Are they not strong enough, or are they not like can they not produce enough like concentric rate of force development to push out of it? Okay, if that's the case, like what can we do to work on that? Let's do a lot more of our jump progressions. Let's do non-counter movement jumps. Let's do like our split stance, like Bosch step up type stuff, where they're
Mm-hmm.
having to drive through a single limb, or even like band resisted accelerations. Because all we're doing is we're giving them more time to produce force, and then we use that training, but we follow it up with our testing. So it's like whether that testing is force plate technology or even just taking video analysis. Like there's so many apps out there right now. Like one, you can just take a video and watch it in slow mo. If you're doing running analysis, sprint analysis, any sort of change direction, looking at video is a really, really powerful tool because when you look at it frame by frame, you see how this person is self organizing. That in and of itself is a data point. Like it doesn't tell you why they're doing it, but it tells you the outcome of what they're doing. then you have to piece it apart and say like, well, from a physical standpoint or from a coordinative standpoint, what are they missing with this strategy? So it's like goes back to reverse engineering. It's like they look great linearly, but the second they start moving laterally, now they've got this like ridiculous trunk lean, or they're not comfortable getting their foot outside their base of support. So what do we have to do to rectify that? Is it giving them some sort of drill where you build confidence with it? Or is it a matter of like, all right, they don't feel comfortable with that because they can't produce peak forces through their lower extremity to actually stop themselves from moving. So the only way that they can tolerate that is by using some sort of other like asymmetrical strategy or trunk strategy to complete the task that you're asking them to do. And then as you get further and further, like I look at it as mid to late stage, it's no longer just like physical therapy testing, quote unquote. It's more of like your performance testing. So I've actually told coaches this, and I've told a bunch of students this in the past. Like return to sport testing from a standpoint of like what we're actually looking at, I look at it as like off-season testing. So if we were to look at this athlete and imagine that they never had an injury, obviously we know they did, but if we have an athlete who's recovering from a long-term time loss injury, I would literally say like, hey, let's look at this athlete as if they're a otherwise healthy individual coming off an off season. Let's compare them to their peers. Let's compare them to some of their age match norms from like a skill level standpoint. Where if you're dealing with like a Division I soccer player, like compare him or her to their peers, compare it to like standardized testing or normative values. And there's a plethora of that out there, and it's getting better and better. But you can look at it from like a bucket of needs standpoint of like, all right, what is their relative strength? What is their power? What is their jump capability? Like things like Vald and a lot of the force plates have better normative values that are kind of accruing. Then we can look at things like, all right, what about conditioning? There are a million conditioning tests out there that a lot of college coaches love using. So in some instances, maybe we use that test just to see where this person stacks up against their peers in their competition. Because ultimately, if they're less than like 85% of their peers, and we're talking about return to sport or return to play, I have concerns. And it's not even to say that this person will get injured again, but like their performance is not going to be up to what they're expecting. And the better the athlete, the more frustrated they're going to be if they go back to their sport and they feel like they're not performing. So sometimes I'll use that as like, hey, your testing didn't go as well as we thought it did. Let's use this as an opportunity to get you feeling better before we put you back in the game. But we will find opportunities to get you doing more stuff in practice and with your teammates. So I know that was a long-winded answer, but does that answer your question in terms of like analytics?
Yeah, and well, look, I what I like about that is that you touched on some of the quote unquote objective measures through like data points through technology, right?
Mhm.
But you also touched on, and that was going to kind of be my next question, is some of the subjective stuff where look, not everybody has the resources and the bandwidth to get a lot of these things. So how are we operationalizing this process from somebody who, like you said, a lot of times the rehab and the training is the assessment, right? I know Lee Taft talks about how like a lot of the way he identifies like the limiting factor for athletes and how they move is like small sided games, right? In a lot of ways, this is exactly the same. Is like you're putting them through these different like training sessions, and as you're watching them adapt and move and do all these things, like you're going to get a pretty good idea from a subjective lens where this athlete's biggest limiting factor is and what buckets need filling, right?
For sure. And it also goes it also goes back to what you were saying before with like collaboration, where like as they get to this later phase, it's like, all right, at this point, hopefully they're working with a physical therapist and a strength coach. But now as they're getting incorporated into some kind of practice, whether it's just like drill based or closed loop stuff or maybe small sided stuff, now if you have that relationship with a coach, you can ask them, be like, hey, what are you seeing that's good or that still needs work? Because hopefully the coach knows his athlete better from a pre-injury standpoint, so they can give you other data points in terms of like, all right, they're good linearly, but the second we add some sort of change direction or like a lateral step, they just lose it, or they're like one step slower than they used to be. Like we need to work on that. So getting that information is just as helpful.
Yeah, and I love the fact that you talked about like what are the normative values for that individual's age, sport, those types of things, as well as collecting data from the coaches. Because you could, I mean, a lot of ways you have a lot of time with these athletes. In some ways, you could build up a lot of some of their deficits from previous, like to their injury, um, and I'm sure you've had the experience where athletes think they're ready to go back, and from a comparative standpoint, they're not ready, and then comparing them to normative values, like, hey, getting back to that point you made, that's really well put, is because you can use that as like a, hey, you're not ready per these normative values, per these like objectively, like you're going to go in and it's just going to get frustrated. You're going to get frustrated. So let's wait till, or at least within, like, do you have a threshold in terms of where you're at with that athlete?
So it depends on the test. Like a lot of the research looks at like greater than 90% limb symmetry. So if we're talking about things like strength testing, like like a lower extremity, like knee extension, knee flexion test, usually greater than 90% is what the research is looking for. I think the reality is that is actually very hard to get to for a lot of athletes. We know it's important, and we're always going to keep working on it. But I've had the experience of a lot of surgeons who will clear athletes who probably shouldn't have been cleared, who have like say like 80% limb symmetry, where it's like one
Hmm.
quad is 20% weaker than the other one. Like in my opinion, that's still a yellow flag. Like I don't feel comfortable with that person going back to full play or sport at
Yeah.
that juncture. But I would say like in general, like rule of thumb for a lot of circumstances is at least 85%, if not greater than 90%. And that's on the early side of things. That's saying like getting back into more sport. It doesn't mean full competition. It doesn't mean full participation. It means like controlled minutes, controlled drills, maybe like doing stuff with like short-sided games with athletes that they know and trust. Like that's the sort of stuff I'm talking about getting back into. I really don't like that idea of like return to sport as a yes or no, because ultimately it is a continuum. Like return to sport is multiple data points along that continuum. It's like I look at it as like this is return to drill, this is return to some kind of like full practice, this is return to like short-sided games, this is return to scrimmage, this is the return to play. If you look at it as like 4 or 5 different buckets, it becomes easier to make those decisions, and it's no longer as stressful on you as a coach or you as a clinician to say like, oh crap, they didn't pass this one test, can I trust them to go back? Because the reality is you could have somebody who has almost perfectly symmetrical strength, who has had no exposure to their sport, and if they go back at that time, they are potentially a liability to both themselves and their teammates. So I would much rather give them more exposures to what they need to do and give them the opportunity to feel more confident with that before we give them that formal like, yes, you have a full go on all contact, all participation, all games. Like that's a big step.
So now when you're looking at like limb symmetry and strategy and all that stuff from like a objective data collection, whether it be force plates, how often are you testing these things in your training process? And is it all of them? Is it some of them throughout the week, between the 10 deck and different type of force plate jumping and things like that?
Mhm. I think the first consideration I have is what is the mentality of the athlete I'm working with?
Hmm.
And I'm sure you can appreciate this. There's some athletes that like to have that number, and every week they want to test it because they want to push themselves, and they want to see that needle go forward.
Yeah.
But then there's also that subset of personality types that they're like super neurotic, and say they're coming in with a really bad day, or they're fatigued, or they didn't sleep well. And if you test them every single time, every single week, or multiple times a week, regardless of the test, if they have a couple sessions where they're seeing a detriment in their performance, oftentimes they're going to start freaking out a little bit, or they're going to be like, oh, why am I losing progress? What do I need to do more of? What am I missing out on? So I think part of it depends on the type of test. The other consideration is the personality, and the final one is like how much resource or how many resources does this test take to do? If we're talking about something super simple like let's check range of motion, I will do that every session. That takes 5 seconds. The person's not going to freak out. Versus if I'm doing like a maximal effort jump test or lift test or like isometric strength testing, like those numbers based on readiness are going to go up and down potentially more than 15% based on the day. So when it comes to doing more of like my higher priority KPI tests, what I try to do is I try to hedge my bets, and I only do it like I might not tell the person beforehand. I'll see how they look in warm-ups, I'll see how they're feeling that day subjectively, I'll see like what their like subjective like speed and confidence and stuff looks like. If it looks like they're having a good day, that's probably a really good day to actually test them, because the odds are they're going to express their true like maximal capabilities, as opposed to if you get somebody on like a 75% day where like they're not bad but they're not good, that
Hmm.
number doesn't really mean anything to me. Like
Yeah.
I'd rather be more selective in terms of this is a good opportunity to see what this person is expressing, let's do that today. So I
Hmm.
think the easiest example is like force plate testing. If your legs are dead, like you just did a heavy strength day like a day or two ago, and then you come
Yeah.
into PT and you're like, I'm going to do some maximal counter movement jumps, and you just look like your feet barely leave the ground. Like, is that giving me useful information? Absolutely not. Versus if I have an off-season athlete, which I know you guys have worked with, it's like, all right, if I have like say 8 to 12 weeks, maybe once a week, I want to have regimented testing where the athlete knows this day they come in, they're doing this test. So mentally they're prepared for it, they're looking forward to it, they're trying to push themselves. In that case, I will do that stuff every single week. But it's not like that's the thing that irritates me a little bit about research. It's like we know it's important and we need to depend on it and utilize it in practice. But the reality is like we can't test people every single session, because then we're not doing any sort of training. Like that's where that whole like training is the test keeps coming back. And I think I have kind of biased myself a little bit more towards that as of late, because doing more testing is not always the answer. Like, yes, it gives you a lot of information, but is it pushing the needle forward? The answer is no. It gives you direction in terms of what direction you need to push. And ultimately, that's why we're doing it in the first place.
It certainly doesn't have to be done all the time. And I think in some scenarios, people just do it because it's, hey, let's test for the sake of testing. And it's, we got this expensive tech, so let's use it. So
Yes.
I really like how you took into consideration like the personality of the athlete and how potentially they would respond to good or bad data points. Right. So
Like I think just
especially when these athletes are in such a neurotic state, and they're all different. They're all coming at this experience from a different lens and a different perspective. So we have to be supportive of that and make sure we're putting them in a scenario that we're going to be respectful of that as well. So, we talked a lot about a return to play protocol, but in an ideal world, like we'd be working with athletes to mitigate this. We certainly work really hard to do that and making sure we're checking all the boxes with our athletes. What are some things that you think from a performance standpoint, outside of just return to play and injury prevention and things like that? What can we do as strength coaches or physical therapists to maybe better prepare our athletes for the field of play? Like, are there some things that you're seeing missed on a relatively consistent basis in the just like overall performance and development standpoint?
the first thing that comes to mind when you ask that question is the idea of like you have again two spectrums of athletes. You have the athletes who do nothing in the off season, or
Hmm.
and then you have athletes who do everything or don't have an off season. So it's like it
Yeah.
depends which person you're talking about, right? Like if you're talking about the athlete who takes 3 months off during the summer and they don't do anything, and then they come back to preseason and all of a sudden they're like, oh, I should be as good as I was the end of last season. It's like you haven't done anything for 3 months. You're going to feel terrible. You're going to look terrible. You're going to feel weak. It's going to take 2 or 3 months to get you back into the shape that you were in at the end of last season. Versus the contrary to that, which I think we're seeing more and more of, is like the full year training, play, practice. Like there's no off season. I think like from a increased injury incident standpoint, neither of them are good, right? Like on one end of the spectrum, the athlete who doesn't do anything is underprepared. The athlete who doesn't stop doing anything, like doesn't ever stop, whether it's season or multiple sports or what have you, ultimately what they're doing is like it's not that they're underprepared, but they're under recovered. Like they never have any actual developmental phases. Like they don't have 2 or 3 months to actually get stronger. They don't have 2 or 3 months to learn new skills. They don't have 2 or 3 months to actually like be a kid or be like be anything other than an athlete. And I think we've seen, you and I both seen a lot of those examples of people who it's like whether it's they're being pushed by their coaches, they're being pushed by their teammates, they're being pushed by their parents. I think one of the most important things that I think our industry has to do better going forward is being better about like how do we care about this athlete's long-term development as opposed to what they're doing this season, what they're doing next season. Like if we're talking about a freshman in high school, your training approach for that young athlete should be totally different than what you're doing for a junior or senior in college because their amount of training history, their actual maturity, their skeletal maturity, their athletic performance are going to be very, very different. So like even just from a standpoint of like what is in the best interest of the athlete, it's making sure that they have like more of a consistent schedule, like week to week, month to month, and year to year. Because if we can instill that from an earlier age and they understand why that's important, they're going to make better life decisions for the long term.
I like that perspective because breaking down the young training age to the high training age, like a college athlete and going into professional sports is it takes a lot of educating that athlete as to like what performance training looks like, especially when they've had so many years of just grinding out in the weight room. And you get a lot of type A competitive athletes who get in a weight room and they just want to crush weights and get stronger. And there's a period where like that just has diminishing returns and they don't need that anymore. And then they also wonder why, like as they get later into college and closer to pros, like if they keep training like that, will they start to see their performance go down? They start to feel like crap on the field. And like, what are some of the things that you utilize in terms of creating more buy-in with those older athletes more with a substantial training age? What do you utilize with them in terms of like getting them to understand, hey, what got you to be a good athlete when you were younger is not so much the case now?
Yeah, it's definitely diminishing returns, like you described. I've had that example a lot, where like I always think of like the typical like football player, right? Where they're doing potentially in college, they're doing the same type of workouts they did in high school. So it's like they're doing heavy back squats, they're doing heavy deadlifts, they're doing heavy bench. Now, if you're an offensive or defensive lineman, that might still work for you because those
Yeah.
guys are meant to not turn, right? Versus if you're a wide receiver, a running back, a quarterback, like that is not an intelligent training program for you potentially at any point in your career, but especially as you get older and as you become more skilled. So like I look at that as first I have to develop a relationship with the athlete where they trust me to make changes. Because if you have a really high level athlete who has really good potential and you tell them day one, like, hey, we need to mix up your training, like what you're doing doesn't make sense, they're going to walk away from you potentially. So I look at it as how can I like give them a little bit, I'll still give them some of the stuff that they think they need. And I'll give them a lot. I'll start to kind of like titrate in more of the stuff I think they need. And usually what happens is like it's like Pareto's principle, like 80-20 rule. Like 80% or like 20% of what you do gives you like 80% of the results. If I can give them a little bit more of what I think they need, or based on their metrics and based on their KPIs is showing me they need, over time, I'm going to start to kind of ramp that up, go from like 20% to maybe 40% to 50%. And then maybe I'll keep it there for a little while until they literally tell me, like, oh, I feel a lot better. Hey, their performance is getting better. Or hey, their testing is getting better. And then I might sit down and have a conversation with them and be like, the reason we were doing these things was to develop certain qualities that you weren't getting otherwise. Like, this is the kind of stuff that you shouldn't feel as banged up for. Like, you're still working hard, but maybe we're turning down the volume, or maybe we're taking a bar off your back. Maybe we're using other types of loading strategies, so we don't have as much of like a systemic stressor as opposed to like a local stressor that we're trying to get like from a performance standpoint. And once, like, athletes are very like introspective and generally like very like kinesthetically aware of what they're doing. So when they start to feel those improvements, they're like, oh, my hips move better. Oh, I'm turning better. It's like, hey, that's at least partially a byproduct of like how you've been training. Let's keep training this way and let's build that up. So like I look at it as like you're almost tricking them into it early on, then you get buy-in, and then once they trust you, you can
Yeah.
do whatever you want. Like
Yeah.
I will never take somebody's program from like your typical 5x5 meathead program to like the everything is asymmetrical and there's no bar in your back program, because that athlete is just not going to trust me right off the bat. But if
Yeah.
I kind of like every cycle we change it a little bit and we add in new things and we give them more variability of movement, generally speaking, as long as you're a good coach and you understand basic programming principles, you're going to see really good changes, and that person will feel less beat up. Their athletic performance will be better, and ultimately they'll come back to you being like, I don't know what you did last offseason, but like I felt great. Let's do that again.
Yeah.
And if you're doing that, like you're in a very good spot.
Yeah. And touching on that point is like, I think in a lot of ways, people, when it comes to strength and conditioning, become very dogmatic in their pursuits of performance. And it's like, well, you got to do it this way, like the West Side. And then you get your other people on the other end of the continuum where it's like, you can't put a barbell on your back. You got to do everything from a single leg. And there's a continuum there. There's parts of the off season. Yeah. Like we're going to crush some heavy weights because you do need to get strong. You're not going to play 162 games and be weak, right? Like
Mm-hmm.
there's going to be like that's going to hit you at the end of the season. So we have to utilize those things, but it's more or less like, okay, like in this lift, we're trying to drive outputs, but everything else, we're trying to refine movement and, the kinesthetic awareness, brain to body, like get like motor control, that type of thing. So that's one thing that I've really pushed my older athletes who've been with me, training with me for, 5 to 10 years. It's like, look, yeah, there's going to be periods where we are going to push strength and you're going to feel like crap and like your nervous system is going to be fried, but we got to see that valley in order to see that upswing. Right. And so like usually for my pro guys, it's through the months of December, late November, December. I tell them ahead of time because I don't want them to get freaked out. I'm like, look, your sprint times are probably going to go down, right? You're going to like some of your jump metrics are going to go down a little bit, but that's fine, right? Like we're in the period of the off season where we need to stress these things. Now, as the trend goes, as we get closer to the season, like you're going to start to see all that stuff kind of swing back up. So just trust me, like we're in the valley right now. We'll come out, we'll come out of it. And so giving them the context and giving them the understanding and reasoning behind it. Sometimes if you're not doing that, like it's tough to get buy-in. So that's one thing that I've really stressed with our older athletes, like our more advanced professional athletes over the last several years. So
Yeah, the one thing that I think every coach and every physical therapist who works on the performance side likes to talk about is that idea of like minimal effective dosage. But the reality is, I think a lot of people are unwilling to actually like error to the left of that spectrum of like what is the least amount I can actually give this person to either maintain qualities or to potentially improve qualities that, like you said, like, all right, like there are times that we probably need to do some heavy squatting, but like what's the least amount of heavy squatting we can do to see an appreciable change in the type of metrics we're looking for, as opposed to like always beating them into the ground so they then can't train any other qualities. So it's like that's where it becomes that art and science of like how do we, like, based on the person, based on their history, based on what's worked for them in the past, how do we leverage those data points, and then how do we make future training decisions based on how long we worked with this person for.
yeah. And look, there's parts of the year where overreaching is okay, right? Where you could err on the side of being a little bit overzealous with the volume. But then there's also parts of the year where like you can't, like that's not the priority. That training is secondary to what they need to be doing from just an overall skill and, speed exposure. So we talked a lot about training and physical therapy and all that stuff. I know for many years I don't know how many years you had said, but you were working in a clinic with people day to day, and you've since transitioned to running a performance mentorship. It's Built to Last Performance Mentorship. Tell us a little bit about like what was the main impetus for that transition?
Mhm. Yeah, absolutely. So So I've been like a performance PT for I think roughly 7 years now. I've been a S&C coach for over 10. So like essentially I found out through my previous job. So when I was at RGP previously, I was lucky enough where like I was immersed in a setting where we had a lot of really passionate young minds that were very talented, had very good background knowledge, very good mentorship. And ultimately what that kind of drove me into was kind of like a leadership and like almost like an inherent mentorship and educational role within the facility that I was working in. Like I was very lucky. Like my past colleagues were incredibly driven, very smart, like always ask good questions. So that literally forced me to level up my game because I was in like a site director position. I was in a position where I had to onboard new clinicians. I had a lot of physical therapy students. So it was kind of nice because looking back on it, I realized I got a ton of repetitions of helping people figure out problems and develop their own treatment process and their own training process, which ultimately it's like the more I saw, like the more I did it, the better I got. And the more I realized like I actually have a passion for teaching, I have a passion for education, and honestly like spreading the quote unquote like gospel of training. Like how can I
Yeah.
give this to more people so that they make fewer mistakes that I made earlier in my career? Because as
Hmm.
as every young coach does, like I let ego get in the way, and early on I thought I knew best when in many instances I did not. So the long and short of it is like I was part of RGP Academy for I think about 5 years. So we actually created a return to sport course. So we created a weekend course called the Blueprints course, and we would literally I traveled to probably 12 different states over the course of like the 4 or 5 years that we taught this course. And I was lucky enough to present to groups of upwards of 20, 30, 40 people at sometimes. And they were all coaches, physical therapists, athletic trainers. And it was really, really cool because the more I did that, it's like you start to realize like no matter like what your credentials are or the letters after your last name, it's like we all have a common goal. It's just a matter of we have different skill sets. So I started to realize like, okay, I like teaching, I love mentorship, I love education. How can I turn that from like a side hustle where I was doing it like a couple days a week or traveling like once every couple months into something that I'm doing as like a true like full-time gig? So basically what I did is over the course of the last couple of years, in my mind, I think I was creating this project, which eventually turned into the Built to Last Performance Mentorship, which is literally like on an online 12-week course where it's built out where every week you have access to new material. So it's basically one of my past colleagues joked like I basically created like a 3 credit college course, but it's meant to be for performance physical therapists, strength coaches, athletic trainers, chiropractors, like anyone who works with athletic populations or active populations. This is meant to appeal to. So in a nutshell, what I did is like this was probably a year and a half ago. I sat down one day and I wrote out like if I was a new grad, what is the course I wish I had that I could have gone through that would have expedited my career? And literally just sitting down, like I wrote out like a probably a 3 page document because I just like word vomited, and it literally turned into the outline of like what this project
Yeah.
actually is. So like the whole premise was like, all right, how do I start with like how do we create someone's like internal treatment model, like mental model, like how they approach problems, how they coach, how they train, all the way up through like more of the from like the theory into the actual practice of like, all right, how do you take these practices, these processes, these mental models, and how do you turn them into actual coaching and training decisions? And then from there, it's like, all right, cool. How do we get to some higher level thinking when we're talking about the reconditioning process, or we're talking about somebody who has a very complex history of injury or complex demands because they work in pro sports, or they're a high level athlete who's trying to get to the next level. So it's kind of like it went from a passion project to a main project. And as you know, because you've built a business as well, it's like I am pouring so much time and energy into this, but it's really cool because like what I'm realizing is I'm taking the last 10 plus years of experiences that I've had personally and what I've learned from my own mentorship, and I'm kind of putting it into my own model. But in a way, it's cool because like I can constantly update this and add to it. So like every additional cohort that I have, I'm trying to add new things, add more resources, add more case studies, but the underlying content is going to stay the same. It's just a matter of like how do I expand the kind of the body of knowledge so that more and more people have access to this information, and it's more of like a consolidated source. Because I'm sure you get this. Like I've had countless people who ask me like, "Hey, what book recommendations do you recommend for performance PT or for plyometrics or for return to sport?" And I think to myself, I'm like, there is no single book. Like all of the knowledge that people like ourselves have comes from countless sources, countless people, countless experiences. So like this is my attempt, at least my first attempt at trying to consolidate all this information into something that's very meaningful and hopefully very valuable to everyone that takes part in it.
You've had experience in multiple different settings of physical therapy as a strength coach, working with people. Now, where are some of the gaps where people are missing in terms of getting, improving their capability as a strength coach or a physical therapist?
From a physical therapist standpoint, I think it's a lot of that like mid-range stuff that we talked about, where it's like when the athlete or the client is like getting to the point where they're doing a lot, but then that bridge, like that gap between like, okay, they're doing functional stuff, they're doing training, but they're not performing at a high level. I think a lot of the gaps in people's knowledge are like, how do we like take that performance dial and slowly turn it up, as opposed to like turn the faucet all the way on, right? So it's like, all right, I think a lot of it comes down to like having an intelligent progression, understanding like what KPIs are useful, as well as like what is the limitations in your own scope of knowledge. Because there are going to be certain instances, like obviously you work with a ton of baseball guys. Like I will never claim to be a sports coach for baseball players. Like there's certain pieces of information and certain like demands that everyone has to understand, whether they're on the PT side or the S&C side. But ultimately, it's like, all right, once you get to the higher level, like technical execution, I want to entrust somebody else to that. I don't want to
Mhm.
make changes to technical considerations or anything like that. But what can I influence? I can influence things like range of motion, potentially a little bit of coordination, definitely some strength aspects of it, as well as improvement in overall just like physical readiness and competency. If I do those things, that's within my scope of practice. From an S&C side, I think ultimately it comes down to what population do you work with? Because if you work in a facility that works primarily with something like baseball, your primary tools are actually going to be quite different than if you work with like higher level like football guys. Just from a standpoint of like the physical demands of the sport are very different. So understanding like what do I need to get better at is ultimately always going to make you a better coach or clinician. And I think that's the cool thing of having any sort of collaboration. Like going back to like the mentorship, like it's cool because we have people who are coming from different fields and different populations and work with different levels of athletes. So hearing their perspectives, it's like we all have a common goal and our processes are usually similar, but the actual tool, like our toolbox and like the way that we implement them is often very different. And that's cool to see because ultimately like we're drawing kind of from the same pot, but the way that we're distributing that is going to be a little bit different based on like time constraints, based on athlete constraints, based on equipment and resource constraints.
Yeah, that's one thing that I see as like a common thread with a lot of the conversations I'm having is whether it's physical therapists or strength coaches is people are starting to appreciate and understand the importance of learning the skill in the sport that you're coaching, right? Not that you have to be at an expert level, but from in terms of like shapes, patterns, signatures, like the way the athlete moves from an energy systems development standpoint, you need to start understanding these things. And in a lot of ways, it's like how much context can you gather from those athletes? And it just comes from speaking with like skill coaches, sport coaches, and then with the athletes, and then really just making sure like we're meeting them where they're at in terms of where that development limitation is. Would you say like you're running into a lot of that with some of the people that you're working with from a mentorship standpoint?
Yes, for sure. Like just to give a little snapshot, like the current group I have one guy who works. He only has two or three athletes. He works with one on one. He's a physical therapist and S&C coach. He works entirely with three NFL offensive linemen. So his entire caseload is three guys. So going back to like I thought of him immediately when you mentioned that because ultimately I've had conversations with him where he's very well versed in the demands of the sport, the technical side, the training side, and even like the mental side of it because you have to be like his entire job right now is dependent on the success of three guys. So he needs to understand them to a T. Versus like some other people that are in the mentorship are we have everything from like physical therapy students who are going through school right now, some people that were under 5 years of experience, and people that have over 10 years of experience. So it's cool because like the people that are under 5 years of experience, they're doing what you just talked about of they're literally just building out their toolbox. Like it's kind of one of those things like you don't know what you don't know until you get to a situation where it's like, oh, I have no idea how to proceed. And then you realize like I got to fill in these gaps versus like your over 5 or 10 year people. Generally, it's like they have a really good skill set. Like they've done the thing thousands of times. Then it's more of like, well, what's my actual like mental framework or my process for making these decisions? And as you get older and older, like as I've come to find as well, it's like it's easier to fall back to old patterns. But if you audit yourself or you look at your process and you say like, all right, in the past I did this, was this the best course of action, or is there potentially something else I could have done differently that would have given me another result? So I think a lot of it comes down to like decision making from a standpoint of like look at your past decisions, look at what other people are doing, and say like, okay, is there potentially a better, more efficient, more linear path to getting the same outcome? And if so, how can I extrapolate that and how can I apply it to other things? It's almost like you're taking almost like an AI approach to like what is my process and how can I like create redundancy in my process so that the more I do it, the smoother it gets and the better my outcomes get. Like I think inherently that's how my brain has started working. It's like we understand n equals one, like the athlete is their own person, but if we can use past like what are their demands, what are their fellow athletes or clients look like, how can we build that out to like what our kind of idealized picture of this future athlete is? the more exposures you have to that and the more you understand the sport and the demands, the easier it is to say, like, where does this person fall in that spectrum, and what do I need to dose appropriately to get them where they need or they want to go.
I 100% agree with that. You, as a coach, you need frameworks, right? You need a system, so to speak, but not like it can't be super rigid, right? Like your system is what you utilize from a scalability standpoint and how you reach multiple athletes. But you use your testing, you use your training as a way to assessing like what that athlete needs, and then you kind of you audit and you iterate from there. And so essentially, what you're trying to do is help these clinicians, strength coaches, so on and so forth, like come up with those frameworks, but also give them the knowledge of how to address the nuance of iteration from case to case.
Yeah, absolutely.
Love it. Love it. What excites you most about what you're doing right now?
Honestly, the thing that I'm loving the most right now is like having organic conversations with like professionals and coaches and clinicians that I wouldn't otherwise have. Like it's
Hmm.
been very enlightening because like this first cohort has 30 people in it, and we have like 2 live calls a week, so we get an opportunity to actually discuss the material and hopefully apply it. And it's been very refreshing because there are certain things that I would like lecture on or I'd present that to me were like, oh, like this is just kind of like I don't want to be rude, but like somewhat like common knowledge from a performance standpoint. But to like a physical therapy student, it's like this is novel. Like they've never heard it presented in this way. And even like some of the more experienced clinicians have said like it's really nice to have this information packaged in such a way that's so concise, where it's like you're taking a lot of information, putting it into like a very like tight knit package where it makes sense and it's more regimented. I think for me, like right now, I'm in that phase of my career where I want to consolidate as much knowledge as I can, because it's like the ebb and flow of like you take in information, then you consolidate information. You take in new information, you consolidate information. So I think for me, like somewhat selfishly, I like that I'm able to put all this information into one package right now because it actually is helping my own thought processes. And like when we've talked through case studies, like I'm trying to help some of these other clinicians like deal with some of the more complex cases or refine all their processes like you just talked about. And it's really cool because like sometimes you see those light bulb moments where you have a conversation with somebody and they take a brief pause and they're like, oh, I never thought of it like that. And then right
Right.
afterwards, like they start
Yeah.
spewing out a bunch of like, I could do this, I could do this, I could do this.
Yeah.
And it's like that's like my passion for education right there, is like
Yeah.
when you can pass on something like quote unquote wisdom, like you can maintain it yourself, but you can also provide it to someone else. Like it's like this gift that keeps on giving. If we can find like for myself personally, if I can find ways to kind of keep doing that and like build out this platform and build out like the number of other clinicians I reach, I look at this as like, how can I provide value to as many other people, as many others as possible? And initially, I think I did that through working with the patients I was working with. But now I'm like, well, from a macro standpoint, I can do this by influencing other coaches and clinicians who work with hundreds, if not thousands of other clients. And now my relative reach and value has just increased potentially like 100-fold. So when I look at it like that way, like it's very fulfilling and it's like very passion driven in a way where I'm applying my natural like nerdy skill set to something that will help others outside of just me working one on one with other clients. So it's a really good mix.
Yeah, I can really appreciate that because I've been running a business for over 18 years. And for probably the first 15 to 16 years of that, like I was very much like a strength coach with, and that was that was my day to day. And in the last 2 to 3 years, like I've really kind of taken a step back and kind of like your point to, for many years it was you serving the person in front of you. Now it's like you're helping other people and giving them the tools to help others. So indirectly, you're still helping people, right? I see it the same way. Like I for many years, like I just poured as much as I could into the athlete in front of me. Now it's how can I positively affect my team so that they can help more athletes at scale, right? And so I can definitely respect that, and that's something where like I feel like it's a healthy evolution for people in our role. And look, it's really hard as somebody who works in practice to be that person for so long. It's exhausting, right? Like it takes a lot out of you. So, you're a brilliant person, somebody I've been around a bunch, and like you just have this way of taking very complex systems and problems and making them very simple, which is why like I love what you're doing right now, and I think it's so many people are going to benefit from it.
I appreciate that very much. Like everything you just said is like I keep reminding myself of this idea of like growth mindset versus scarcity mindset,
Yep.
because I caught myself earlier in my career. Like I was more selfish earlier in my career where I felt like I had such good mentorship and I had so much knowledge. I was like, in some ways, I was almost like, I want to keep this knowledge to myself so I can be a better coach, or I can be a better clinician.
Yes.
And then I've realized, like, honestly, these last 4 or 5 years, I'm like, the more I share, the better I understand it and the better I learn in the future. So it's like I look at it now as like I can share as much knowledge as I can, and then what the conversations I'm having as a result of that, or even just like airing out that thought process, is making me a better thinker and is making me more well-rounded as I do that. So it's like it is the definition of mutual growth, and that's what I honestly that's what I'm really excited about.
Out of curiosity, because I went through a very similar mindset shift, what was the tipping point for you to kind of go from that, you know, I'm focusing on myself to get myself better and positively affect my situation the to the latter and where you're trying to positively affect others?
That's a great question. I can't honestly I can't pinpoint a single point in time. I think for me it was probably more of a byproduct of major life changes. So
Okay.
like for me I've had two massive like life related changes in probably like the last 6 or 7 years. The or even less, maybe like 3 to 4 years. Like my first major decision was when I decided to leave my job in Maryland, where I was at essentially like the quote unquote pinnacle of my career. I was in a job that I thought was my dream job, and for a time it really was. And it got to that point of like what you said, like I was working my butt off. I poured everything into the people I was working with, the students I had. I have no regrets about that, but I realized like I didn't have anything left for myself. Like I wasn't really feeling fulfilled. I just felt like I was working. And then that led me to go to Resilient, where obviously I got to work with you and those awesome, that awesome team there. And then it was not the same thing, but I was there for about 2.5 years. And then it was almost like my eyes were open. Like I tell other people, like once you make a big life decision, like I quit my previous job without
Yeah.
having another job lined up. Like I was actually in a perfect situation where Resilient had an opening and I jumped on it because I didn't have a job. So I sold
Yeah.
my last house. I moved from Maryland to New Jersey. Like I took a dive and these guys trusted me, which I'm forever in debt to. And then ultimately what happened is like once I made that dive, I was like, oh, like I have more control over my life and my autonomy than I ever realized. And then I started thinking about like, well, like my good friend Alex Hubblebank, like she's like a career guru. Like she and I had countless conversations and she basically says like, well, make your own dream job. Like if you could do whatever you wanted to do, what would you do? And I thought about this for weeks and months, and ultimately it was like I would literally just like I would create something that has value. I would teach, and I would still work in some capacity in a clinical role because I like that. So like I basically created like my future dream job, and right now that's what I'm working towards. Like I love what I'm doing right now, but I like the diversity of being in the clinic. I like coaching. I like educating, but I also like even writing. Like I'm finished the manuscript for my first book and I have to edit that hopefully by the end of this year. So like I have like three big buckets that I'm trying to kind of fill right now, but I'm realizing like I'm just shifting my priority based on which one is in front of me right now. And that's like honestly making me feel very fulfilled and very excited for what the future has to offer.
That resonates with me because I think in some ways, and maybe you're the same way, is that you get into a certain situation expecting, like you have a goal in mind, right? And you achieve that goal and it's like, well, maybe it's not quite what I was expecting. I can see it being a little bit better. And I feel like it's oftentimes in our roles and in our like situations, it's like sometimes the inputs aren't worth the outputs, right? And as you get older, you have different competing demands in life, and you know you're a little bit different from me, but for me it was like kids, right? It was a family. Like I couldn't keep going at that rate, but I also realized that if I kept operating in the way I did, I would be stuck and I would never get out of this trap. And by all accounts, like 5, 10 years prior to that, like I was living my dream. And now it's like, okay, now it's evolving, and again, it's kind of like the training. Like you create a situation, you create a frameworks, you establish a goal, you hit that goal, and it's like, now what iterations do I make? Like, how can I make it better? What can change? And so, yeah, maybe it's just the constant pursuit of optimization, or nothing's ever going to be perfect, because once you get there, things are going to change. So I'm curious because it's something that I went through a very similar mindset shift, and I'm better for it, right? Like by all accounts, like my team is thriving, the annex is thriving, and I truly think that if I didn't go through that mindset shift, like I would not be where I am today. For me, from a leadership standpoint, like it was the next necessary step.
Yeah, it's kind of like once you see it, you can't unsee it.
Yeah,
Like thinking
absolutely.
back to it, it's kind of like the old Matrix, like red pill versus blue pill. Like once you see reality, or you kind of peer behind the curtain, you see like, oh, this was my dream job, and then you see
Yeah.
all the like the pitfalls of it and the things that you don't like about it. It's like, okay, like I like this part of my dream job, but now my new dream job is I want to do this. So
Yeah.
it's like it's literally the idea of like, all right, you're trying to like kind of curate your own career based on
Yes.
like what drives you internally. And I think you've done a tremendous job of that with everything you've done with the Annex.
Thank you. Yeah, and it's funny, again, I look back at like all the challenges I faced 5 years ago, and it's like it was all me. I was the roadblock in everything. So I just had to get out of the way and we've got brilliant people here and just let them do what they're best at. And so it's been wonderful. Well, Mike, this has been great. I always appreciate your time. If I'm somebody who's interested in finding out more and maybe getting in the next cohort, like how can I find out more about it?
The easiest way, just go on Instagram. My handle is Dr. Mike_Reinhardt. The next cohort is going to open in early September. It'll be 3 months. So it'll be all of September, October, November. My hope is to do about 2 mentorships a year because I want to keep the quality really, really high. Like I invest a lot of time in this and I want people to get a lot of benefit from it. So the next one will be in September and it's open now if anyone wants to reach out or ask questions.
Well, Mike, thank you, sir. For those of you who tuned in and listen all the way to the end, appreciate you. If you haven't already, please like and subscribe to the show. It allows us to bring on future guests like Mike and other really bright-minded people and reach a bigger audience. So thank you.
Awesome. Thank you so much, Mickey.